Could you have diabetes and not know it? Simply, yes, of course. In fact, over a third of people that have diabetes don't even know it. Why is that? Well, there aren't really good symptoms to rely on. In the past, when diabetes was first discovered, they saw symptoms of thirst and uncontrolled weight loss. But that was diabetes that was very far advanced. If you don't have symptoms, what do you look for? Well, first, know the risk factors. Second, understand the disease. And third, get the proper testing. So what are the risk factors? By far the most common type of diabetes is type 2, and the major risk factor for that is age. You start getting significant uptick of prevalence of diabetes after age 50. As we mentioned earlier, huge number, 29 million Americans 65 and older have full-blown diabetes. What are other risk factors besides age? Weight. Weight, or body mass index of greater than 25, is a significant risk factor for diabetes. Combine that with age, and you've got challenges. What's a third common risk factor? Family history. So if you're overweight, if you're in your 50s or especially 60s, and you've got a family history, you really need to be tested. Now, so that's risk factors. What about understanding the disease? Again, in the past, when they looked for thirst and weight loss, they were looking at very advanced disease. We're looking much earlier now. In fact, we're looking for what we call insulin resistance. Those of us who work with diabetes on a regular basis realize that diabetes can damage the body long before the patient needs insulin, and significantly before the patient takes any types of medication. We call it the diabetes highway. You may have heard the term prediabetes, or another term, metabolic syndrome. So, again, know the risk factors, understand the disease, and then third, get the proper testing. What are the proper tests? Well, first of all, you could consider getting a home glucometer. Every corner drugstore has a home glucometer that diabetics use to do a finger stick glucose test. Now, is that going to tell you? It'll help. Try testing your blood glucose in the morning before eating anything, and then 3 or 4 times a day. Do that 2 or 3 times a month, and you begin to understand the pattern that your blood glucose shows throughout the day. That's important to understanding your risk for diabetes. Get a Hemoglobin A1C test, but don't rely on it too much. There have been a lot of folks that have significant insulin resistance and even diabetes with hemoglobin A1C tests that may not completely indicate it. There's a variation of over 10%. I've had patients where they were husband and wife, both of them had hemoglobin A1C in the low 5s. One of them had very significant insulin resistance, causing heart attack and stroke risk. The other one had none. So how did I know that, and what is the more definitive test? It's oral glucose tolerance test. The oral glucose tolerance test tells us exactly what performance insulin is at in your body. Your pancreas makes insulin, and as you age, that performance decreases. It's the most definitive test. It's inexpensive, but it's a hassle. You have to go NPO, or nothing by mouth, the night before, then get a blood test in the morning at 0 hours, another blood test at 1 hour, and another blood test at 2 hours. I'm Ford Brewer. I'm a physician. I've prevented heart attacks and strokes in my patients for over 30 years. This information is free. Subscribe to the YouTube channel. Send it to your friends. Live free of heart attack and stroke, fear, and disability.